Good afternoon. Welcome to the CDP webinar, COVID-19, Grantmaking to Support Children and Older Adults. This is Regine Webster, Vice President at the Center for Disaster Philanthropy. This webinar is presented in partnership with IMC Trading and is co-sponsored by Interaction, the National Voluntary Organizations Active in Disasters, the Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, the United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. So I'm going to do a little housekeeping before we dive into the meat of our conversation. This webinar is being recorded. It'll be available along with recordings from past webinars on our website and YouTube channel shortly after the webinar is complete. All registrants will be sent a link to the recording. Now, at any time, you can go to the little Q&A box at the bottom of the screen and submit any question that you might have. We'll do our best to get to as many possible questions at the end of our panel presentation. And if there's questions that are not addressed and answered during our time together, we'll send over a follow-up document, our follow-up document will be available on our webinar page and also on our website, and that will help round out any questions that we didn't get answered. If you're on Twitter, please go ahead and use hashtag CDP4Recovery to share this discussion. During this time today, we hope to cover 4 different things. First, how these two populations, children and older adults, at either end of the age spectrum are being disproportionately impacted by the COVID-19 pandemic. The significant mortality and morbidity rates among older adults and what needs to be done to address them. The disruption in schooling among young people due to the closing of childcare and educational facilities. And lastly, the impact of social isolation on both populations. I want to share with you that the Center for Disaster Philanthropy recently awarded its 5th round of grant making from our COVID-19 Response Fund. In this round, we provided grants to 10 additional organizations totaling nearly $3 million. Grants were awarded to Action Against Hunger, Catholic Charities USA, Color of Change, Concern Worldwide, the Food Chain Workers Alliance, Hyatt, Medical Teams International, Operation Hope, the Schott Foundation Loving Communities Response Fund, and Vibrant Emotional Health. We've now awarded grants totaling nearly $10 million to 41 organizations to support the global response to this pandemic. And we are already working with more nonprofit organizations on plans for our 6th and 7th rounds of grant making to continue to support urgent needs and as well as explore recovery opportunities from the effects of the virus on domestic and international communities. I'd like now to introduce our guests. Elaine Ryan is the AARP's Vice President for Government Affairs. She leads the association's state and local advocacy on health and financial security in states and localities across the nation. Elaine earned a Master in Public Administration from Harvard University Kennedy School of Government and a BA in Economics from Fordham University. Dr. Lynette Fraga is the Chief Executive Officer of Childcare Aware of America and a passionate practitioner, advocate, and leader in the field of childcare and early learning, working to advance the accessibility of quality childcare experiences for all children. Lynette has over 25 years of experience as an educator, program director, and executive leader working on behalf of children and families. CDP is very pleased to have awarded Childcare Aware of America a $250,000 grant to support childcare providers across the country. I'd like to welcome you both and thank you both for taking time away from your work to speak with us today. Really, really appreciate it. Elaine, let's go ahead and start with you. Again, let me just say again to really appreciate you joining us. Thank you so much. Tell us about some of the areas that AARP has focused on since the pandemic started.
Well, thanks so much for having me here today. It's been an extraordinary time for all of us. I dare say unprecedented in our lifetimes, and ARP really plunged into action in states across the country in March, like many of you all on the pandemic. And so our areas of focus include health, long-term care, access to voting, workplace, housing, hunger, and disparities. Just a wide-ranging agenda because this pandemic has touched so many in so many different ways.
I'd love to take a deeper look at two of your advocacy initiatives. We know that a significant number of cases and deaths have occurred in the nation's nursing homes and assisted living facilities. Can you tell us, in detail about what types of advocacy you all at AARP have been undertaking in light of this?
Yes, thanks so much. And the next slide might be helpful for all, just to summarize that there's a crisis going on in nursing homes and assisted living facilities across the country. 1.3 million Americans call nursing homes their home. And since March, an estimated 40,000 nursing home residents have lost their lives to COVID-19. And more than 90,000 have been infected with the virus. And just to put that also in some context, these data are preliminary data. They're just based on states that bothered to report deaths and cases in nursing homes. About 20% of the states have failed to report at this date. So you can see the numbers are extraordinary and we think quite low. And in many ways, of course, at the beginning of the pandemic, a lot of the focus was perhaps rightly put in the hospital settings where people were concerned with access to ERs and intensive care units and so forth. And even then we saw the reports of workers and staff just struggling to get basic needs met. Well, if you could imagine that the federal government actually gave nursing homes and residential care facilities a lower ranking in terms of priority. And though the outset of the pandemic, we saw deaths in Washington state in nursing homes to COVID-19, even then, when we saw mounting deaths and infections, there was no priority given to nursing home settings. So AARP has continued to raise our voice on getting basics. Not only public disclosure, if you could imagine that it's been difficult to get that, public disclosure of the names of the facilities with any COVID-19 cases. You also may know that visitors were banned in March so that families and other loved ones couldn't visit their loved ones in these facilities. So we at AARP really raised the sound of alarm because we had no idea and continue to have no idea what's going on in these facilities with respect to infection control. The federal government suspended inspectors, long-term care ombudsman, banned visitors. So in many ways, the most vulnerable people, some of the most vulnerable people in our country were left without any recourse. So AARP not only has called for personal protective equipment for staff and for residents, but also a regimen of testing and screening, and also contact tracing, as well as what we call virtual visitation. And that is being able to connect family members with their loved ones so that they can have some contact with what's going on inside. It has been a national disaster of epic proportions. And it continues. As you may know, nursing homes are regulated at the federal and state level. Assisted living facilities, which house another million people in this country have virtually no regulations. And so they're not even being reported on. So this crisis continues. We urge any with interest to stay connected with AARP as we advocate at the state and federal level and raise the sound of alarm.
Thank you for that, Elaine. It's sobering to think about the regulations and the reporting. Just appreciate you shining some light on that. And our understanding is that older adults are going to continue to be at risk for some time to come. And even as states reopen, older adults are being advised to stay home. However, since 2020 is an election year, what have you all been doing at AARP to ensure that seniors can cast their votes?
Well, thanks so much. And the next slide pretty much illustrates the work that we're doing. You may know that AARP has long had a robust voter engagement effort in all elections, national, state, and local. And we do so in a nonpartisan way because access to the ballot is key. And as you mentioned early in the onset of the pandemic, there were also primary elections scheduled in more than a half a dozen states, and yet we know people were advised to stay at home. And so AARP, for all people of all ages, we're advocating with secretaries of states, with governors, with state legislatures, many of which had recessed for the year, to do a few things. One, to move the election date, which we successfully did in several states. We also advocated for mail-in ballots so everyone could exercise the franchise to vote. And also, we worked to try to simplify what are quite arcane voting laws across the country, and do so through an emergency power of governors and secretaries of state that required witnesses to attest to someone's application for an absentee ballot. In many states, for example, in Wisconsin, and people may have followed the tragedy of seeing people standing in lines in the rain in a pandemic to cast their vote, only to find out that dozens contracted the virus while doing so. AARP also worked with people across the state to guarantee that people did not have to go through this double attestation where witnesses would have to be acknowledged through windows to be able to say that we believe you should have access to an absentee ballot. Our work continues. We work through the primary. We're continuing our work as we go through the elections, some of which have special ballot measures in June and July across the country, and we're gearing up for a robust effort in the general election so all can exercise the right to vote.
That is so impressive, and definitely I'm learning as I'm listening. So I try not to pick favorites when it comes to questions, Elaine, but I have to tell you, I'm really looking forward to learning from you as I ask this next question. We know that one of the projects you oversee is called Disrupt Disparities, and it's a program that links age and racial and ethnic disparities. Can you tell us about the intersection of these two vulnerabilities, please?
Yes, of course. In the next set of slides, I just thought I'd give an overview of some of the work that we've done, and I'll tell you some of the states that are underway. You know, in 2017, we kicked off our work in New York State with our AARP New York office in cooperation and in partnership with the NAACP, the Urban League, the Hispanic Federation, and the Asian Federation of New York. In order to examine what were disparities experienced by people age 50 and older in the areas of health, financial security, and community. And our work was unique, I think, in that there isn't much research actually that's gone on with people who are 50 and older, and rightfully a lot of the disparities research is done for children and also young adults. So ARP took a deeper dive at this disparities work, and then joined with these organizations to not only publish data, but then publish recommendations for advocacy and action. And so the next slide will show that we actually in COVID-19 just recently launched what we considered to be Disrupt Disparities 3.0, where we looked at the access issues and the inequities that were showing up in COVID-19 and in disparities and by age in New York. Things that we could advocate and did advocate for, like access to home delivered meals, expansion of SNAP outreach and enrollment, the establishment of a long-term care disparities task force, in language information on the pandemic and health issues experienced in community, as well as advocacy to protect essential frontline workers, to expand paid and sick leave for those essential workers. And then the next slide, not to go on and on, but it also just talks about our work on housing. So many people in New York, 50 years of age and older, are in rental, but the rental settings actually, there was fear that the people would be frankly in loss of their housing due to their loss of income. So we are fighting for protections in housing and for mortgages and for property taxes to be extended. And also a more robust data collection so that we can truly understand the implications of the pandemic on all people of color and also people who are older. And then finally, we have a pretty profound initiative on xenophobia, especially among the Asian Pacific populations that are experiencing such discrimination during the pandemic, so afraid they hardly leave their homes. And so I think we may have one more slide, and if not, I'll just summarize by saying that ARP has work that's ongoing in New York. It's in Michigan. We're in Illinois, and also our office has been appointed to the mayor's task force on racial disparities, that we're working in community. We are teeing up for release of reports in Arkansas, DC, Kansas, Kentucky, and Pennsylvania in the coming months. And our advocacy efforts are expanding in New York, Massachusetts, Illinois, Pennsylvania, South Carolina, and more. So this idea of disrupting disparities really comes from our CEO, Joanne Jenkins' call to disrupt aging so that all can choose how they live as they age. But we know that everyone doesn't have the same choices. And that's why ARP has launched and will continue to work on Disrupt Disparities. So stay tuned for a next set of states to join in advocacy. We don't do this by ourselves. We need to do this in concert with organizations that have long fought these battles. ARP is lending its voice and advocacy to these efforts moving forward. So thank you.
Thank you so much, Elaine. Again, so helpful and really revealing about not only the work that you're doing, but also the really important issues you're working to address. Super appreciate that. Lynette, we're going to go to you next, but before we do, just a reminder that anybody who's listening right now can use the Q&A box at the bottom of the screen, just like three of you already have. to put questions in that we'll hopefully get to at the end of our webinar once we finish our kind of more formal question and answer time. So Lynette, again, over to you. Tell us, what are the biggest impacts you're seeing of COVID-19 on children right now?
Thank you so much first for the invitation to participate and all that you do for children, families, and communities. And I'm particularly grateful for this webinar, given your focus on the multiple generations. And thank you, Elaine. I learned so much when I just heard you describe what your great work. And I'm grateful, not only given my role as the CEO of Childcare Aware of America, whose mission was described earlier to ensure that each and every child has access to quality, affordable childcare, but also because I'm on the board of Generations United, whose mission is to improve the lives of children, youth, and older people through intergenerational collaboration, public policies, and programs. So I really do feel both of these topics are so critically important. So again, thanks for the invitation. In response to your question, what is critical to state and restate is that the first years of a child's life, particularly the first 5 years of a child's life, present an opportunity to promote social emotional skills that build a strong foundation for school and life. And at the same time, it's also a vulnerable period of development. Young children have experienced many changes due to COVID-19, like social distancing from trusted caregivers and loved ones. For example, a grandparent they might not be able to see, or aunts and uncles, or their family childcare providers, or their teachers, or their parents suddenly working from home, or maybe not working at all, or working with a great deal of stress, or not working and a great deal of stress. And then as we face reopening, possibly transitioning back to childcare programs as they reopen, all of this creates a lot of disruption and stress. And maybe it's not the same center, or maybe it is the same childcare program or center, but maybe there's different teachers or different children, lost friendships potentially, children that were in your program or classroom or your family childcare program before are no longer there, and they can feel and look different. And this is really stressful for children, and supporting children's emotions is so critically important, again, particularly the first years of life, but certainly through childhood. Caregivers who have lost childcare report actually that their children are significantly more fearful and fussy than those who have not lost their childcare programs. And according to a weekly survey of households with children's ages 5 and under, that was conducted by the Center for Translational Neuroscience at the University of Oregon, this was the case. And so adding to that, the recent protests around the country after the death of George Floyd in Minneapolis may have led to even more change and questions from children about issues like racism and justice and what does protesting mean? And it could make rise to possible concerns and perhaps even more stress and anxiety for children. And for parents who are trying to figure out how to talk about all of this change just over the last few months and support children through these tough conversations. That said, positive, supportive interactions during everyday moments with parents and caregivers do help children develop important skills for understanding and communicating their emotions. And parents and caregivers also taking care of themselves, which is so important. We say to take care of ourselves, it's really hard to do, but for our children, really critical to do. If our caregivers and parents actually take care of themselves emotionally, when it's so stressful, they can also address the emotions and stress of their children. And just as an aside, we do have resources on our website at childcareaware.org that parents and childcare providers can use to help children cope with traumatic and difficult emotions and events.
We know that COVID-19 has had social, health, and economic implications to it. And we also know that a number of childcare providers have been unable to survive the shutdown. So if the trend of childcare programs being unable to open their doors continues, what do you think that means for community resilience?
Well, firstly, no childcare, no recovery. If families don't have access to childcare and childcare programs, it's really tough for them to return to work and for communities to reopen. What we've learned through the pandemic, firstly, is how essential for many American families childcare is to be able to return to work. Prior to the pandemic, more than 12 million children younger than age 5 were in some form of childcare in the United States. And we knew at that time, and certainly we as an organization were really advocating for quality, affordable, accessible care. And the childcare system was really fractured and challenged, under-resourced, both as individual childcare workers and certainly under-resourced as a system. So we're really already facing a great amount of challenge. When the pandemic hit, as you can imagine, we really are in a space of extreme challenge and potentially decimation of a system of care for children. Nearly half of parents in the University of Oregon National Survey that I just mentioned reported losing childcare arrangements that they had been using prior to the pandemic. And they're really, really concerned that they're not going to be able to return to work in the next month. And 67% of these caregiver providers, parents, said that they expect only themselves or their spouse or partner to provide care for their child in the next month. And so that has a significant economic impact. The childcare industry in the United States has a total impact of almost $100 billion, according to the Committee for Economic Development. And so as we're thinking about impact of childcare and its importance to communities writ large, you know, if childcare providers are unable to survive the shutdowns, we not only have a problem in the moment today as we're reopening, but as we continue to think about our communities going back to work, it's going to be a real struggle, and there'll be significant barriers for families. And oftentimes that means a significant level of inequity of access.
You know, I'm glad that you looked or foreshadowed the conversation about reopening. So as schools and child care centers do begin to reopen, we understand that it's predicted that there's going to continue to be this need for social distancing, smaller group sizes, smaller classes, et cetera. You know, from your perspective, what do you think this means for delivery of services and for for both working parents and caregivers?
Well, as reopening happens, there certainly will be more demand as parents start to go back to work, but also fewer children likely being served. So closures of childcare providers are going to mean that this more demand, and as the providers that do reopen, and fewer children served. Enhanced health and safety measures could lead to providers serving fewer children, which makes a lot of sense, right? Because it does cost money to purchase personal protective equipment. It costs money to ensure that your spaces and places are sanitized and that you're providing the kind of healthy care, of course, that you want to be able to provide. But they're with different group sizes, smaller group sizes, smaller adult child ratios. This could really mean an expense. And truly what this means is the sort of the business model, the way that, again, there certainly isn't, providers certainly aren't making money and are often underwater. Prior to the pandemic, they're really underwater. And sort of the whole way of providing childcare is turned on its head. And which could essentially drive more providers to have to close their doors. So at a time when demand is increasing, the number of providers is decreasing, and potentially more parents and guardians may have additional childcare responsibilities as a result because they can't access care, which could prevent some from being able to return to work. And I think an additional and important note to add here is that working parents are taking on an additional 28 hours a week of childcare and housework during the pandemic, with women taking on a disproportionate share, according to a recent survey by Boston Consulting Group. So there are choices that parents are having to make, and how that might show up in returning to the workforce and potential inherent inequities in access to work or continuing to work is a real challenge as well.
Lynette, I'm sorry, my heart just stopped for a moment. Did you say an extra 28 hours a week?
Yes, that is exactly right. I'm not quite sure where folks are finding the time, but literally that is what's really happening.
Well, thank you for that. Thank you for stopping my heart with that fact. Oh, okay. And I think that you're going to tell us also about a recent study. And you know, when we spoke, you talked about how the study shows that the shutdown may result in the loss of equivalent of a year of learning of kids of all ages. So can you tell us a bit more about the study? And then can you also talk about how philanthropy can support children's programs and resources to make up this gap?
So first, to be sure, philanthropy cannot do this alone. And I think Elaine alluded to this as well earlier when she was speaking about raising voices and points of advocacy. Without meaningful federal investment in childcare, there will be barriers for parents as they return to work. And we know that, again, the first 5 years of life and what we know about brain development and the science of early childhood, learning does begin from birth. So we're not only talking about learning for school-age children, what we're talking about is the growth and development of all children, and particularly those most vulnerable and those youngest. So what we estimate is that Congress has to provide at least $50 billion that will allow childcare programs just to weather the current public health and economic crisis. We actually did a poll with Save the Children Action Network, and we found that 4 in 5 voters support the child care industry receiving targeted financial assistance from the federal government to address the impact of COVID-19. So there is a growing understanding. I think it began prior to the pandemic, but it certainly was difficult to ignore through the course of this pandemic, particularly as we were looking at first responders and emergency personnel and hospital workers, essential workers, that in order for our communities to function, firstly, we need those individuals. And secondly, those individuals need care for their children. So I often talk about our childcare providers as the heroes that are caring for our heroes' children. And we need to ensure that we're recognizing and acknowledging the contribution they're making. And I think there is growing momentum in that regard. As we move through the various phases of recovery and reopening the economy, again, I think there's a real understanding that we can't do that. We can't restart learning. We can't fill the gap in supporting children and families as they grow and develop and try to thrive absent investment. So because of this big lift, what I suggest is that philanthropy can highlight the importance of childcare and early learning programs with key audiences, particularly policymakers and the media, to make the case with data and tell the story with and to policymakers and the media about how critically important this population of children are, certainly, but also these really essential workers who support us all to keep our economy and our communities moving.
Yeah, again, such compelling information there. Thank you so much, Lynette. All right, it is that time of our webinar where we turn over to our audience Q&A. And Elaine, there's one question here that's I think fairly straightforward, so I'm going to put this out to you. It says, could AARP be a little more specific on when the upcoming disparity reports will be released? Interested in when the PA report is scheduled to be released.
Yes, thanks so much for that question. Of course, the pandemic set us back a bit in terms of the production of these reports. So with respect to Pennsylvania, I'd say we're several months from a publication date on that preliminary research. And the other, just to say that our later this month, we'll have the second installment of the Michigan disparities work. You may know that the Lieutenant Governor heads up their racial and ethnic disparities task force for COVID-19. And our office in Michigan is putting forth recommendations there along with new research. So Michigan will be the next report to be released, and we expect that Pennsylvania will be in about 2 months.
Super helpful, thanks. Here's a question for both of you. What's being done to prevent caregiver burnout for both special needs parents and for caregivers of adults? Lynette, do you want to start?
Gosh, what a great question. What I think is pretty apparent, I think all of us, is the real need to support the emotional health of us as adults and as children as well. So critically important to focus on, and what we often do is early childhood mental health and mental health supports. How do we bake the support for early childhood mental health consultation to family childcare and center-based programs for teachers to be able to learn and know how to support themselves, as well as how to support the emotional lives of the young children in their care. Again, young children, even the youngest children from birth, are emotional and social beings. And so, and it's a really critical time to support that social emotional health so they can grow up to be healthy emotional learners as they grow older. So really focusing on the mental health of young children, but also recognizing that young children grow up in the context of relationships and healthy relationships. So again, focused on really nurturing the nurturer and ensuring that there are mental health supports for teachers to be able to talk to those that can support them as they try and get through these times of crisis and uncertainty.
Elaine, do you want to add to that question?
Yeah, thank you so much. The family caregivers are often the hidden heroes of our healthcare system, and we estimated ARP there are about 41 million people who acknowledge they are family caregivers for their older loved ones, whether it be a parent, a sibling, or another loved one. We know that if we paid those family caregivers, it would cost this country about $370 billion a year. So what ARP has in place, and since, well, I would say for the last 6 or 7 years, we have a sweeping campaign to support family caregivers. And during this pandemic, we've not only done specific efforts to help them with what we can do with virtual mental health stress tips, but also we're advocating for supports. Many Americans who work, 50% have no access to paid or unpaid leave. So often they're forced to choose between caring for their loved one or losing their job. So workplace supports is very key for us, as well as financial supports. And I will say that the average family caregiver pays out of pocket about $6,000 a year, and you can imagine the financial support. But if you also think about caregivers who are African American or Hispanic Latino, the cost out of pocket to care for their loved ones can be in excess of $8,000, and for long distance family caregivers, $10,000 or $11,000. So our efforts also have been to try to provide financial support for family caregivers in the by way of family caregiver tax credits to be able to support those families. And I will say that during this pandemic, though many people were involved, ARP was certainly at the forefront to make sure that stimulus checks were provided to individuals. In fact, at one time, Congress was considering giving older people half as much stimulus payment than other Americans. But also still Congress fell short in terms of any recognition of the enhanced financial support that all family caregivers have for their loved ones, particularly at this time. And finally, what I will say is that during the pandemic in nursing homes, there was also a huge effort to try to get their loved ones out of those nursing homes and bringing people home. You can only imagine the stress on families. And so ARP is doing our best to support them in this time of crisis, but also thinking about systematic reforms who have been so woefully inadequate to support family caregivers who, if they gave up on the job, would cost this country hundreds of billions of dollars.
Thank you for that. Lynette, I'm going to bundle two questions for you. The first is, are there any data yet on the number of childcare providers not reopening and or kind of the ability to see that information by state? And then the second question I'd ask in this bundle is the childcare sector support already in the upcoming relief bill? If not, it is likely going to take a long time to get federal support for this sector. What do you think of the role of philanthropy and also social impact investment to bridge the gap and avoid such a loss in operational childcare providers, which would otherwise further increase disparities?
Wow, those are two really big questions. I'm going to take.
Sorry,
no, that's a great bundle. I'm going to take it on. I will first say, in terms of programs that are not reopening and what that actually looks like, and if there is data about not reopening. First, I'll say there's some projections around how many programs may not reopen, and that's anywhere from 30 to 50% or more may not reopen. So we may literally lose half of our childcare programs in the United States. It is a sort of an array from 30 to 50%, and the reason or more. And the reason for that is because programs are still making decisions. You know, sort of we're in the midst of this still for many programs who have not reopened yet, or they have reopened but haven't made a decision yet about whether or not they're going to permanently close. And there are multiple reasons for why that may be. Some of them are not reopening and waiting to see whether or not they're going to permanently close or not, because they're awaiting the kinds of potential federal support that may be coming down the pike. They may be trying to sort of understand how the pandemic is actually going to hit their own community from an economic perspective and from a reopening of businesses perspective. Obviously, it's very intertwined. So what we know is that, and what we are consistently asking as a community of childcare system providers is how can we project the potential for providers to close? So we're a little early yet, but some early numbers are certainly reflecting a significant amount of concern, because very early in the pandemic, many providers responded to surveys that said that they could only survive being closed for 2 weeks. And this obviously was a question asked a couple of months ago in April. And so that's significant, that there likely is going to be a pretty severe impact on childcare and childcare closures. In regards to the second question about how, firstly, yes, $3.5 billion was given to and funded the childcare system under the CARES Act. We still are advocating for additional funds. Again, as I shared, up to $50 billion is needed just to keep childcare system going. And there is some momentum and bipartisan movement around the understanding of childcare in the system. However, it's one thing to first get that legislation and those dollars tagged for childcare, but it's also another set of circumstances that get those dollars actually into states and states into programs. So there is a need to bridge that gap. What we're hearing from programs, and where firstly, and I think most significantly, philanthropy can also always be supportive in ensuring that we're keeping the drumbeat, and I would say probably drumbeat cymbals orchestra band alive around the necessity of the childcare system and the real impact on childcare providers who themselves have already been in a really challenged state, who often can't afford to send their own children to the childcare programs that they're at, and often are qualified themselves for different kinds of programs based on low income. And so already in a challenged state, really trying to survive, and need supports and services, both business supports to be able to sort of bridge the dollar gap to keep their business going operationally, but also prospectively thinking about, from a longer term perspective, there is the potential for the pandemic to continue to impact communities into the fall and into the winter. And I think it's critically important for us to think about what we've learned about the needs of both parents and providers to keep programs open and alive, and have a heartbeat, so that when we are able to get through this pandemic, that we actually have a childcare system to return to. So it's on the ground equipment, materials, resources, and supports. It's training and technical assistance. It's helping to bridge the operational gap. And most importantly, I think it's raising our voices at the state, local, and federal level that childcare is absolutely necessary, not only for the economic recovery of our communities, but also because our children need us, and they are stressed, and they need emotional and physical and healthy nurturing settings during such critical times in their lives.
Here's a question for both of you, Elaine and Lynette. During quarantines, everyone's been encouraged to limit their social contacts, and many facilities, as Elaine already indicated, have banned visitation. And one of the major impacts of quarantine has been social isolation. So how have the two of you seen social isolation impact your communities?
So I can jump in.
Elaine, you want to go first? Oh, you want to go, Lynette? Great. Yes.
Great.
No,
I'll go ahead and go. Loss of childcare has really resulted not only in parents not having the supports needed to go back to work, or children having these settings, but parents often partner with their childcare teachers and their family childcare providers, and not being able to connect with each other and provide sort of emotional support is also a real loss. Supporting the development of children when you're working and you're supporting your families and so forth can be often very stressful, particularly if you're very stretched. And so remember that childcare providers and teachers are not only a critical workforce support, they are key partners with parents in children's healthy development and in quality programs, a key and critical relationship to children. So though we've often seen, and many have probably seen, awesome interactions between teachers and school-aged children, even preschool children in the media and social media utilizing technology, we have young babies and toddlers, infants and toddlers, and they're also feeling a loss, and so are their parents, because they often partner with the development of their children with the important adults in their lives. And so there is a real loss there, and those connections are so critically important. I certainly remember when I was a young mom, it was so helpful to be able to talk to my childcare provider and my family childcare provider about what I was seeing with my child, and just to be able to connect with another adult who really knew intimately my child as well. I can't imagine if there was a loss of that during such a stressful time. And so there is a sense of loss and isolation, not only for parents not going to work or not taking their child to care, but also because they really have lost this partner often as well. And these children have lost an important adult in their life potentially. And so we see, you know, higher rates of stress and anxiety compared to those children who've been able to continue using some form of childcare. And that could really impact healthy brain development. Again, as I said earlier, such a critical time in a young child's life from birth to 5. And this University of Oregon survey that I shared earlier really does focus on some of that loss and isolation felt and the impact potentially of stress at persistent high levels on young children.
Elaine, how would you answer the question about social isolation's impact on the community you serve?
Well, before the pandemic, AARP published a study that showed that there was a direct relationship between social isolation and health status, showing that social isolation could be equivalent to smoking 15 cigarettes a day in terms of the healthcare cost to Medicare. So we know that social isolation is a public health issue. And when you think about this pandemic that not only has banned visitors from assisted living, hospitals, nursing home facilities, but also just extended that isolation as people were advised to shelter in their own home. We certainly saw early on that this was a call to action. So AARP set up a community connections site that called for volunteers, and we got thousands of them to agree to even call to connect with older individuals in their communities by a telephone call, and asked people whether or not they wanted to have someone to connect to, feeling totally isolated at this very unprecedented, and I'd have to say scary time. So a shout out to our CEO, Joanne Jenkins, and our AARP Foundation for pulling together that effort so quickly that continues today. And also AARP has advocated for that kind of connection to be done virtually. You know, the technologies to do FaceTime and to connect via telephone are all there, but we still know that there are hundreds of thousands of older adults living in facilities who have no one to help them facilitate that technology in those facilities to be able to connect to their loved ones. So AARP has worked and advocated for the purchasing of iPads and telephones to be able to be given to residents so that they can connect with their family members. Many of those connections are really life and death connections. And we put out a call just for a request for personal stories. And in 3 days, AARP got 6,000 personal stories of individuals who were trying to connect with their loved ones in nursing homes. And we're witnessing once they did make a connection, reported a deterioration in the health status of their loved ones. So this social isolation was a critical healthcare issue prior to the pandemic. It's just been exacerbated, and AARP, whether it's through programming, through policy changes for virtual visitation that we're advocating at the state and at the federal level to keep families connected, realize that this is a critical investment, because living in that isolation, we know, just leads to the deterioration of someone's health and mental health status, and it's something we can help prevent.
Again, so helpful, such a thoughtful answer from both of you. And I dearly and personally appreciate the way that you both are able to bring the facts and figures to the forefront about how your communities are being affected by COVID-19 and what that means for their lives, their livelihoods, and their health, their overall health. So it's incredibly important what the messages that you're sharing with us today. And I regret that it is time for us to wrap up as we head to the top of the hour, and I'm going to guess that most people on this call have another Zoom call to jump on in 5 minutes. So I would like to summarize some of the discussion and provide listeners with some key takeaways from our conversation. Advocacy is really an important piece of work, and philanthropy has a role to play in that advocacy work, both as a system and as individuals. Wraparound services that provide support in non-traditional ways for older adults and children are going to be highly necessary for recovery. Both children and adults have been socially isolated by the pandemic. I can speak from my own household about the effects of social isolation on tweens and teens. And any response or recovery is really going to need to include some counseling and mental health supports to address those impacts. And then lastly, the shutdowns have also impacted the community supports and connections that exist, both formally and informally. And they're going to really just be more needed than they ever were before as we reopen and move into a recovery phase. As our panelists, Elaine and Lynette, have shared, there's going to be ongoing needs to assist with recovery efforts over an uncertain length of time. CDP and its partners at Candid are tracking philanthropic donations to this outbreak, and as of June 5th, the total of donations stood at more than $11.5 billion with a B. Billion with a B. We at CDP have many resources devoted to disaster philanthropy that can assist you, including our COVID-19 response fund, our COVID-19 disaster profile, our website at disasterphilanthropy.org, our playbook at disasterplaybook.org, and many, many others. And our staff are really and truly just a phone call or an email away. If we can, pick up the phone and help on an informal basis or formal basis, by all means, we're happy to do so. So please feel free to reach out. So this webinar is actually part of a series of webinars taking place the 2nd and the 4th Tuesday of each month at 2 p.m. Eastern through July 14th. Our next webinar is on June 23rd, and the topic is going to be COVID-19, Managing a Global Response. So in order to respect everybody's time and keep this to an hour, this is all the time that we have today. I'd like to extend my sincerest thanks to Elaine and Lynette for taking their time to share their insights and their experience with us. Special thanks again to IMC Trading for partnering with us on this webinar, and to our co-sponsors, Interaction, National Voluntary Organizations Active in Disasters, Council on Foundations, the National Center for Family Philanthropy, Grantmakers in Health, Grantmakers in Aging, the United Philanthropy Forum, and the Funders Network for Smart Growth and Livable Communities. And thank you to all of you who dialed in today. Super appreciate you all. As the webinar ends, a brief survey is going to pop up. If you could take a moment to share your thoughts, we'd be appreciative of that time. And if you have any questions that weren't addressed in today's webinar, you can certainly email them to me, regine.webster@disasterphilanthropy.org. Thank you all so much. Stay healthy and have a really great afternoon.